Well, thank you all for coming. It's great to be here today with the Health Minister, Brad Hazzard, the Jobs Minister, Stuart Ayres, and Dr. Kerry Chant, our Chief Health Officer, to announce some changes to the roadmap. And I want to begin by thanking everybody right across New South Wales for the effort they have made in getting vaccinated. We said from the outset that this was the key to be able for our state to open up safely, and the extraordinary effort from every person across New South Wales has allowed us today to bring a number of changes forward from the roadmap from 1 December, which was initially set out. So for those who are fully vaccinated, there are some changes which we are pleased to announce today. That density limits will shift to 2 square metres right across the board. Capacity limits will be lifted for all settings other than gym classes, which will keep at 20 per class. Visitors to the home will be uncapped. Outdoor gatherings will increase as well for those who are fully vaccinated. And for those which are outdoor gatherings of more than 1,000, they will need a COVID-safe plan in place. Indoor pools will reopen for all purposes. Hospitality will move to 2 square metres indoors. Amusement centres and play centres will open, and major events and major recreation and obviously stadiums, for example, will go to 100% capacity. Now, these changes will come in from November 8 for those who are fully vaccinated. We are also moving back some of the changes. We want to ensure that we, as we open up safely. We'll be pushing back that date from 1 December for those who are not fully vaccinated to the 15th of December or 95%, whichever happens first. We want to make sure as we open up safely. Vaccination rates have been key. Ultimately, though, we want to get to a point where New South Wales is open, one and free, and we believe that the changes we've made today enable that to occur. I also want to make the point, I want to particularly thank Dr. Chant and the health team and Susan Pearce for the incredible work they are doing in relation to the vaccination rollout here in our state. Our booster program commenced yesterday. I want to thank pharmacists and GPs right across the board who play a very important role. This is a long journey. Challenges still lie ahead, but our success as a state in being able to open up safely is a testament to everybody in New South Wales who have gone out, made the effort to get vaccinated, but also those people in our staff in New South Wales Health, our GPs and our pharmacists who have made an extraordinary effort in ensuring that the people across our state are able to get vaccinated as quickly as possible. So my message today to people across the state, if it's been 6 months since your second vaccine shot, please go out, make the effort, make a booking to get vaccinated. We've seen overseas challenges that can occur down the track. We want to make sure that as we open up safely. To date, we have done that in our state incredibly successfully, but there will obviously be further challenges that go ahead. The other point I'd make as well is in relation to testing. Our testing rates are still very strong here in New South Wales, but I still encourage people, if you do have symptoms, please get tested. If you don't feel well, stay at home. These are the small sacrifices that we can all make to ensure as we open up, we do so as safely as possible. I want to thank the teams in health, the economics and treasury teams have worked very closely. We've discussed this and debated this for some time during this period of time, but the reality is we've been able to be in a position today to move, to relax these restrictions earlier, 3 weeks earlier. By bringing that forward, we've been able to ensure that businesses can open, that people can get back into work, to continue to instil confidence. I really do believe we're going to have a strong summer here in New South Wales. The confidence and the strength of the New South Wales economy that we saw last year, I believe will occur as we move through this difficult time. Confidence is key. Opening up safely is key. And the high vaccination rates in New South Wales have enabled us to bring that 1 December date for the fully vaccinated forward to the 8th of November. But ultimately as well, we want a united society, and we believe that by moving that date back to the 15th of December, it will incentivise, and we are hopeful that we can get that rate up to 95%. That will not just be nation-leading, it will be world-leading as well. That is the key to keeping people safe. That is the key to opening up in a way that keeps people in work, that drives confidence across the board and keeps businesses in business. So I'll now pass to Dr. Chant, who will have some key health messages. Then the Health Minister will speak, and then the Jobs Minister, Stuart Ayres.
Thanks, Premier. So there were 173 locally acquired COVID cases reported to New South Wales in the 24 hours to 8 p.m. last night, and 58,988 COVID tests were reported during that period. As the Premier has indicated, it's really pleasing to see those high first-dose vaccination coverages in our 16-pluses of 93.6% and 87.8% were fully vaccinated. In our 12 to 15-year-olds, we've got 79.3% have had their first dose and 62.3% are fully vaccinated. We've currently got 333 COVID cases admitted to hospital and 72 people in intensive care, and 35 of whom require ventilation. And going forward, as we work towards living with COVID settings, our eye will particularly be on those hospitalisations and ICU admissions as an indicator of the impact that COVID is having on the community. In terms of deaths, sadly we're reporting the deaths of 4 individuals, 2 men in their 50s, 1 man in his 60s and 1 man in his 70s. 1 man was from Western Sydney, 1 man was from southwestern Sydney, and 1 man was from Wollongong, and 1 man was from Newcastle. 3 had received 1 dose of COVID vaccine and 1 had received 2 doses of the COVID vaccine. The gentleman in his 70s died at the Tarrawanna Aged Care Facility north of Wollongong, where he acquired his infection, and he had received 2 doses of the COVID vaccine, and it's the 5th death linked to this outbreak. And can I extend my condolences to those who have lost loved ones. In terms of the key messages, as we transition to living with COVID, it was great to see people out and about and great to see those international arrivals and those reunited families. However, it is critical that as we go through this transition phase, we need to retain those COVID-safe practices. So as the Premier indicated, we have to continue to get tested. Even if you're fully vaccinated, you need to get tested. You need to stay home. Those small steps can really help us keep the virus transmission in the community suppressed. We need you to continue to wear masks, and the indoor mask wearing settings will be maintained until the 15th of December. And I really extend my appreciation to the community for understanding that this is a really important risk mitigation strategy for indoor settings. It's great to see the vaccine uptake steadily climbing, but can we just do that big push to get to that for 95% double vaxxed as soon as possible? And can I make a particular call out to the younger age groups? I know you haven't had access to the vaccines for as long as possible, but just to reiterate, there is plenty of vaccine and plenty of access points for you. The first dose coverage is 93% for each 5-year age cohort above 35, but for the 12 to 34-year-old age cohorts, it's less than that. So that group, we really want to see that age group between 12 to 34 shoot up and achieve that greater than 95% first dose and second dose coverage. And why that's important is we know that those age groups actually drive transmission. They're the connectors in our society. They connect with younger people and they also connect with older people. They also have more social contacts. So it is critical we achieve very high rates of coverage in those groups. In terms of the booster dose, please go and get your booster dose if you've had your vaccine over 6 months ago. It's critical that you present as quickly as possible to get that booster. We know the evidence is very strong that there is some degree of waning immunity, and having that vaccine at 6 months will really enable you to have the greatest protection, and that is critical as we anticipate that COVID case numbers will increase in coming weeks to months. Also, there will be a group in the community that have underlying health conditions that really suppress their immune response. So that's individuals that perhaps have cancer, renal dialysis, and for those individuals, ATAGI has recommended that you get a third dose as part of your primary course. And just so there's no confusion, that additional dose as part of your primary course can occur 2 months after your second dose. So if you have any underlying health conditions, check with your GP about whether you fall into the category of needing that third primary dose or that booster. And remember that booster dose is going to be currently with Pfizer, and even if you've had AstraZeneca, you will get a Pfizer booster, and we know that that will give you a good degree of protection. Thank you.
Thanks, Kerry. Well, look, I think it's a great day. A year and a half ago, I think we all wondered whether we'd ever get a vaccine and whether we would ever get our freedoms back. And even as little as 3 or 4 months ago, when things were looking pretty dark, we were all wondering, are we able to get through this in the next few months, or how long is it going to take us? I want to thank the community, because if the community in New South Wales had not been with us on this journey, if they hadn't all come out in the great numbers to get vaccinated, we wouldn't be enjoying the freedoms that we're seeing coming earlier today. This really is a giant step for all of us in New South Wales. And how good is it that we've actually faced down this enemy of this hidden virus and managed to get our freedoms back? I know there are other states who've kept their borders up, and they're going to have to work through that, but we've worked through it as a community. But let's not kid ourselves. The virus is still there. It's becoming a little less dangerous to the majority of the community because most of us have been out and got vaccinated. Some of us are still kidding ourselves about not getting vaccinated, and that's a better outcome. No, it's not. No, it's not. And today, of course, 173 cases reminds us that the virus is still well and truly there, but it is actually slowing in terms of its impact on us, and we're about to show it that we can fight back and we can have our freedoms. But let's not forget that there are some areas in the state that still have a few challenges. You'd remember myself, Dr. Chant, talking a lot about the issues to do with Western Sydney and South Western Sydney. I want to say thank you to the folks at Western and South Western Sydney. You have done an amazing job, absolutely amazing. And as a result, the issues are no longer in that area, but we still have issues, for example, up in the Hunter. There are 64 new cases to 8 p.m. last night across the Hunter New England Local Health District, and 17 of those are in Lake Macquarie, 13 are in Newcastle. Still getting cases down in Murrumbidgee, and particularly in Albury, about 25 in the Murrumbidgee Local Health District. I think 15 of those were in the Albury local government area. We're getting a few scattered across other parts of the state. So Mid-North Coast, there's 3 cases up in the Mid-North Coast Local Health District. Southern New South Wales, 4 new cases. The Illawarra, 5 new cases. So the message is, virus is still out there, but it's if we actually do what we've been doing, that is great partnership between health, the government and the community, then we can actually still have even more freedoms coming up, as the Premier's already described. But how good is today? How good is today? Some people are focused on the Melbourne Cup. I've got to say, to me, this is the winner, the people of New South Wales, on the basis of these new freedoms coming our way. Thank you.
Thank you, Premier. No doubt an extraordinary day for the people of New South Wales, really a recognition of the fantastic work that they've done over the last 20 months. For that period of time, we've had to make many sacrifices. We've had to sacrifice jobs, we've had to sacrifice hours at work, we've had to sacrifice freedoms to be able to protect the health and the survivability of our community. Today is a recognition that we've exceeded our expectations, and because of that we're able to make some prudent changes that allow people who are fully vaccinated to be able to do more things slightly earlier, but we're also going to take that same prudent decision by just holding back unvaccinated people for another couple of weeks. It's in line with the decision that we took around not allowing people to travel into regional New South Wales until we had slightly higher rates of vaccination. There's a really clear message here. We want to get to 95%. We want to encourage people to go out and get vaccinated and get that highest possible rate of vaccination coverage. We also know that we're moving into a transition phase where we are having more people move into our communities, we're having more people move around the state, more people are coming back into work, more people are going out into our hospitality venues. This means that you still have to be diligent about how you conduct yourself, and you have to be thinking about what you can do to minimise the spread of COVID. It's not mission complete. We're not through the entire pandemic. We want to make sure that we can open up and we can get people back into work as much as we possibly can, and we want that sustainable as well. So it's absolutely critical that if you're exhibiting any symptoms, please don't go out. Please don't go to your favourite cafe. Please don't go to your gym. Please don't go to your favourite restaurant. Go and get tested. You can still get COVID if you've been vaccinated. I want to completely dispel that myth that you can't get COVID if you've been vaccinated. So you still have personal responsibilities. Every single one of us has to buy into making sure we take those personal decisions to protect both ourselves, our families and our communities. And if we do that, we'll absolutely protect our economy. As we continue to walk on this journey and open up our economy, we'll continue to take decisions that will get people back in work. Moving to the 1 per 2 square metre will mean more people can come back to work. It will mean more revenue through our small businesses. It'll mean more of the things that we know and love right across our communities. We also know that we're back seeing major events here in Sydney. We've seen the Matildas at Bankwest Stadium. We've seen the Everest at Randwick today. At Randwick, we're also seeing the Melbourne Cup. It's somewhat of an extraordinary day that there'll be more people at Randwick for the Melbourne Cup than there will be at Flemington. That's a pretty signature moment in Australian sporting history, I suspect. But it's a reflection, once again, of the fantastic work that people here in New South Wales have done. These are important steps. They're a recognition of the high vaccination rates, but they're also a message to keep getting vaccinated, and they're also a message to individuals to take personal responsibility. The last thing I want to say is that we all have a responsibility to go and get our booster shot. If you want to stay in work, if you want your favourite cafe or your favourite restaurant or your favourite pub to stay open, then you need to go and get your booster shot. So look at your little green certificate. Your vaccination date is up there in the top right-hand corner. Mark your calendar 6 months from that date and go and get your booster shot. There is simply nothing more important that you can do to bake in and sustain all of the good work that we've done than getting your 3rd dose booster shot. If you do that, you give us the absolute best chance to fight off this insidious virus so we never see it again.
Premier, on the one hand, you're accelerating the reopening because of our great vaccination rates, but then on the other, you're also holding things back in the reopening for unvaccinated people. What's the thinking behind that?
We've always wanted to open up in a measured way, and we've wanted to incentivise vaccination rates, and we have seen an extraordinary effort from people across our state. And ultimately, from the outset, we have said, we put a roadmap in place. We wanted to stick to that roadmap as much as we could. But ultimately, in circumstances where people have made an extraordinary effort across our state, we've been able to move some of those changes forward. As the Health Minister has said, this is a great day for New South Wales. It is a recognition of the effort that everyone has made. But at the same time, we want to make sure that as we open up, we do so safely. Mobility will increase as we move through this period of time. We believe that we can get as close to that 95% rate as possible. That will ensure that we're able to keep hospitalisations down, presentations into ICU down. And as the Jobs Minister has pointed out, this is also about personal responsibility, about people continuing the great work they've done across our state, and in ensuring that we treat people with kindness and understanding, looking out for others. If we look out for our neighbour, we'll be able to ensure that that we keep everybody safe. The Minister is completely correct. Simply because you've had a vaccination does not mean you will not be getting COVID. It is not a panacea, it is a protection. And the changes that we have made today do 2 things. One, bring forward the easing of restrictions for those who have made the effort to get fully vaccinated, to look after people right across our state, but also in a cautious way to keep a couple of those measures that we had set down for 1 December, pushing them back to 15 December. Also, face masks in shopping centres and the like will also move to 15 December. We want to do this in a cautious way, in a safe way, but one that allows businesses to open and people to get back into work. And the changes we've made today have been on the back of the effort that everyone's made across our state. As the Minister has said, going to a 2 square metre rule, for example, will bring many people back into work faster. What a great thing that is, businesses to open and to operate with a much greater capacity. This is being done in a measured way and is on the back of the efforts that everyone has made across our state.
Do we stop checking in at 95%?
No, well, we haven't made any decisions in relation to that. Today's decision is specifically in relation to the roadmap, and we'll speak to the health team as we move through the challenges that arise into the future. QR code check-ins aren't going to be here forever, but at the moment they play a crucial role in ensuring that our health teams are equipped with the information they need to keep on top of the virus. The Service New South Wales app, the efforts that people have made to download their vaccination status, has played a crucial role in ensuring that we can open up businesses as quickly as possible and get people back into work. This is a balanced approach that the government has taken all the way through the pandemic. We've led the nation in relation to opening up. Yesterday was a great day for our state, being out in Dubbo with the Deputy Premier, seeing families reunited, seeing our borders open and quarantine are no longer required for those who are fully vaccinated, has led the nation in terms of us rejoining the world. So the suite of measures that we have in place, we believe, will drive our economy, get people back into work, but ultimately keep people safe.
Is today's decision a reflection that you're more hardline on anti-vaxxers, or was it delaying opening to them? Is that just a trade-off for getting more freedoms more quickly?
Well, it was a balance. It was a balancing act here, and we believe that in circumstances where we could bring some of those changes forward to the 8th of November, we need to consider all the aspects around it. Now, previously we had set that date at 1 December. When you go through all the measures that we have in place, we think today we've landed it very well. We want to have a situation where we could open up as quickly and safely as possible. We brought forward that date to 8 November for the fully vaccinated, but also we set a date today where we are, as a state, 1 and 3. That does not diminish from our continual message to people across the state. Firstly, if you haven't received a vaccination, please go and make the effort to do it. It won't just keep you safe, it'll keep your family and your friends safe as well, and that's really important. The second aspect, which Dr. Chant and the ministers have raised very clearly, is yesterday we led the nation in respect of starting our booster program, and we want people to go out, receive that booster shot after 6 months when you're eligible, because that means we don't go back. We don't want to go backwards here. We want to continue to operate. We want to open up and keep our businesses free, keep people back into work, to balance between the two. But we think where we've landed today is a measured approach that provides greater opportunity early for those who have made efforts across the state to get out and get vaccinated, because that's what's going to keep us safe as we move forward this difficult time.
Just touch on what you said about not going backwards. What's the likelihood of restrictions being reintroduced? We're seeing cases take off in Albury. If they go beyond local health capacity, could we see them limits come back for certain areas?
We've always said, and as part of the national plan and the national roadmap, that from time to time the government might have to look at targeted restrictions. We've always said that's always been part of the plan. But ultimately, we believe where we've landed today and over the course of this period has been to open in a sensible way that keeps people safe. Every time we do this, I understand there'll be concerns. There was concerns when we opened up, when we brought forward the opening up of schools a week early. We understand that will occur. There's still a long journey ahead of us. There are many challenges that are going to come our way. We weigh up the economic and the health advice. We make the decision that we believe keeps people safe but opens up the economy, and I believe that's where we've landed today.
Premier, you said a moment ago that we're aiming to get as close to 95% as possible. You obviously get modelling on this. Do you think we will hit 95% double dose, and if so, when?
Well, I don't want to make any predictions in relation to that. What I will say is we have exceeded where we believed we would be. And that is a great thing from the efforts that everyone across our state has made. I think, and I don't want to speak for the ministers or for Dr. Chant, but we were probably discussing this 6 months ago, to be in a position where we could potentially reach 95% fully vaccinated. I would not have believed that would have happened. And I think we are on track to do it. It's one last push, and I believe if we can get to that 95% mark, plus a strong booster program, which we're already undertaking, I think we can continue to ensure we don't go backwards, we open up, provide freedom and opportunity for every single person across our state.
Premier, what's happening to work from home rules, Premier? What's happening to work from home rules? Currently at the 80%, it's
Can I speak to work from home, Brett?
businesses must allow staff to work from home if reasonably practicable. On December 1, it's up to the employer's discretion. Is that coming forward to November 8 like everything else?
At the moment, we're keeping that as it is, but that's under review. Certainly, our view is that the employers anyway and the business employees have largely... I mean, the one thing that we... Oh, sorry, I'll just take this off. It's under review, but it almost... you'd have to say that people have voted with their feet. They're staying at home anyway. That's what I think the business community largely expect. There'll be a lot more people staying at home. We want them to come back to work, particularly in the CBD, but it's under review. Today, we've made it very clear as to what we've actually moved forward today. That's not one of them, but we're looking at that, and we'll see how it goes over the next couple of weeks.
And is it 1 to 2 squares everywhere? Because there are a couple of places where it was 1 to 4 nightclubs and stuff.
I'm sorry, what?
It's 1 per 2 square metres. Is it going to be everywhere?
Yeah, it's basically one per 2 square metres in almost every situation, yes, it is.
And
Yep.
at what point does that get to 1 person per 2 square metre?
And again, look, that's being reviewed as we go forward. You asked the question. We're keen as mustard to see everybody get out and get vaccinated. We're trying to strike the balance, as the Premier said. We would like to see everybody go and get vaccinated if possible. What we're seeing is it's much harder, as has always been forecast right from the word go, that when we get up to what is an extraordinary rate of vaccinations, it has slowed. So we're doing what we can to provide some incentive, but also a balance about trying to ensure that people... I mean, there are some people who are still hanging out for different vaccines. I know I've spoken to a number of people who think that we're going to see new vaccines coming into New South Wales. I don't think so. We're awash at the moment with Pfizer. So let's just get real, folks, and get out there and get the Pfizer.
It's not international travel. So. It was good to see all that back yesterday.
Oh, it was great. It was great to see so many returning Australians be reunited with their families and their loved ones, and not have to be in hotel quarantine for 2 weeks. And I think I really want to applaud the work the federal government has done as well, because I think the clear direction from the Commonwealth government and in support of the New South Wales government's position is that we need to rejoin the world. And it's pleasing to see the discussion now of bubbles and places like countries like New Zealand, which we're seeing obviously come back, but also Singapore. And I think this is a great path forward, not just for New South Wales, for the country. But I think if anyone saw the scenes on the news last night of family members being reunited for the first time in a long time, what a great thing that is.
Just if you're a fully vaccinated traveller, are you allowed to go to a pub or a restaurant as soon as you get off the plane?
Yeah, well, I think there's been some confusion in relation to that. Obviously, we say there's got to be testing, a negative test within 3 and 7 on day 3 and day 7 on arrival. That is, and also to avoid high risk settings.
But in the New South Wales health regulations, it does say high risk settings are hospitality venues and sporting events
and we're looking at that, Chris.
So did you know about this before the pamphlets went out?
No, we certainly made it clear from the decision-making perspective that it would be in place for high-risk settings, such as no, I don't believe so. And this is, yeah, I understand that, and we are looking. What I can say is what I can say is that we are looking at that. The change was in relation to high-risk settings. From time to time, when we are making these decisions, changes do need to be made. Clearly, there will be omissions from time to time.
There's a plane today, and they get off the plane, they walk straight out, can they go straight?
No. What I'm saying is, we will have this clarified for you.
And also on high-risk settings, right, that applies to vaccinated close contacts. There's 7 days quarantine and then another 7 days where they need to avoid high-risk settings.
Yeah.
In the ledger that includes pubs, restaurants, and all of that.
As I said, we'll provide clarity in relation to that.
Who's checking it?
What was that?
It's a day 7 negative test. Who's checking?
Let's do health on the testing.
So basically, there is a responsibility for the individuals to take responsibility for those results. I think we're moving into an era where people are having to take that responsibility. There are penalties for making false declarations and for not acting. Obviously, if there's any positive test, and there will be probably some auditing processes in place. But I think we are moving with the return of international travellers in the volumes we've seen prior to the pandemic, are very much an individual responsibility.
On the high-risk settings, was that a mistake?
I think it's really around the guidance we would give to people, and I think everyone has to realise that this has been moving very quickly, and we have to calibrate all our risk settings. I think as a general point, we'd be encouraging if people have to be very vigilant for symptoms, as we said, they've returned from overseas, and anyone who's symptomatic, again, would not be recommended to go into those things. They need to get a test. We have got testing within arrival and another test later on after day 7 for completeness. And I think it's just about people being prudent, and we will revise that advice and clarify our traditional ways of thinking about high-risk settings as being aged care facilities, disability group homes and hospitals. Clearly we have processes if people need to go to hospital, that can be done in a safe way, but we do just want that forewarning as we try and keep our hospitals free of any COVID outbreaks.
And now that the booster program started, would you like to see the booster dose being considered in the vaccination status, like the certificate maybe running out if someone hasn't got their booster dose? Like should people who haven't got their booster shots 6 months after they had their first be excluded from society like unvaccinated?
We've got a relatively small number of people that are due for their booster shots, and I think we need to see how the pandemic evolves. We've always got to be proportionate in our response, but I'm very optimistic that the boosters are primarily for the individual benefit, and I'm actually quite confident that with a great healthcare system, the role of our GPs, the role of our pharmacists, that the community will take them up. And it's particularly critical that those boosters are taken up by people with underlying health conditions. We want to make sure that we minimise the impact of COVID, but COVID will be with us. COVID will be with us in the future, into the future, and we are very lucky to have such great vaccines. We need to use them maximally, but we will still need to take those precautions, those individual responsibilities. You know, if you've got COVID symptoms, do not go out and about. Please continue to get tested. We'll also be giving advice around the rapid antigen testing and how they could be used. So I think that I know this is a very challenging time for everyone as we reimagine what living with COVID looks like. It does require us to reflect on our contact tracing, our advice. We've got rapid antigen testing, we've got newly arrivals from overseas. So we're working through all of those issues. But fundamentally, we do rely on the community to make the good judgments that they have been making throughout, to keep themselves, their loved ones, but the broader community safe.
Can I just ask very quickly, I know you said you won't give a running commentary on matters before I can.
Yep.
Some disturbing issues came up yesterday in relation to Darren Wise suggesting to Perrottet she get herself a private phone and download encryption apps. Do you think it's time to tweak the code of conduct so that members of government can't have private phones, can't have encryption apps? Is that something you'd look at?
Well, look, once the report is handed down in relation to the ICAC inquiry that's currently underway, I will consider any outcomes in relation to it. In respect of the code of conduct that's before, I think the code of conduct that we have here in New South Wales is incredibly strong, and that's important because the public expect the highest levels of integrity in public office. But if there,
do you have yourself a private phone?
I think I have a private phone, and I have a private phone, and I think many ministers and many members of Parliament would do that to keep your professional work separate from your private discussions. But ultimately, it's important that information that is relevant to ministerial decision making is conducted in accordance with rules that are in place. If that needs to be updated from time to time based on changes in technology, then the government would always look at it. One of the important roles that ICAC also play is also in corruption prevention and providing advice to government, which they do from time to time on changes that potentially should be made, and I would assume that would also include potential change to the code of conduct.
What did you think of the ICAC hearing? Did you reflect
reflect on Ms Berejiklian's judgment at all, listening to the evidence?
Look, I didn't follow it yesterday. I was in Dubbo with the people of regional New South Wales as we opened up. That's what's front and centre, and I've said from the outset, we won't be providing an ongoing commentary in relation to these proceedings. Every single person in my team is focused on one thing, and that's the people of our great state. There will be a report handed down in due course. If there are any actions the government needs to take, we will.
Many of your colleagues have been very critical of ICAC, and they say that they've overstepped, overreached, and perhaps didn't come up with goods. Do you agree with that?
That would be providing commentary as we're moving through these proceedings. What is important from the government's perspective is that ICAC has the independence to conclude its inquiry. Once they conclude their inquiry and provide a public report in relation to that, if there's any action the government needs to take, we will.
But the ICAC copped a lot of criticism around this in the lead up to it. Now we've had the hearing. Do you back ICAC? You know, there has been colleagues saying that maybe we need to look at it or re-look at the act.
Of course I support the independence of the Independent Commission Against Corruption. They have an important job to do. They have concluded their public hearings. There has not been a public report finalised. The Independent Commission needs to have, free from political interference, the opportunity to conclude its work and to provide a public report. And when they provide a public report, we will consider that report. And if there are any actions that need to be taken by the government, we're not giving, as I've said from the outset, and I'm not changing my position, and ministers are not changing their position in relation to this. There is an ongoing inquiry. Whilst the public hearings have finalised, the inquiry has not concluded. There will be a report provided to the government. Once the government has received that report, we provided publicly. Once the government's received that report, if there's any action we need to take, we will.
But in terms of the ICAC,
What was that?
Will singing be allowed in churches from Monday? Okay,
yeah.
Great. And on 2 square metres as well?
Yeah, so it's 2 square metres across the board, and it's very clear from the changes we've made that we'll be bringing forward from 1 December, fully vaccinated, all those amendments which come through on the 8th of November.
But whatever you think of what happened like that, Gladys Berejiklian, Darryl Maguire, whatever it is, do you think it's fair that it could take in excess of 12 months for that public report to be made public and to either clear them or condemn them?
Well, that's a hypothetical situation in relation to when a report will or will not, when a report should be handed down. What I think is fair is that obviously all people should be afforded the presumption of innocence, and it's not for political commentary to prejudice that inquiry.
You've got John Sidoti who's in limbo, and now you've got Gladys Berejiklian and a whole range of people who are in limbo simply because it takes too long for these reports to be published.
Well, I have made it very clear from the outset. As Premier of this state, I am not going to prejudice the independent inquiries that are currently on foot. The ICAC has an important job to do. They need to be free from political interference in relation to finalising their reports. When they finalise their reports, if the government needs to take action, we will take action.
Former Premier, Mr Perrottet, that at least Ms Berejiklian, who's hanging in limbo now, can't get another job, can't go anywhere in terms of employment even. There's a lot of sympathy for her out there.
Yeah.
Would you call on ICAC, or would you hope that ICAC can do this process as quickly as possible?
Well, obviously I'd like these inquiries, when they commence, to be concluded as expeditiously as possible. I think that is incredibly important. Now, if changes need to be made in relation to ensuring that occurs, then we would look at it. But what I'm not going to say is provide judgment in relation to proceedings that are currently on foot. And sure, this doesn't just affect members of Parliament, it affects other members in the public sector, and ultimately we want to get to a conclusion in relation to those proceedings as quickly as possible. But what I'm not going to have are members of my team giving public commentary until those reports are concluded.
What your predecessors did, just kick the can down the road because it's too politically sensitive to touch.
Well, that's untrue. You're asking questions in relation to an inquiry that is currently on foot. Whilst the public examination has concluded, we will have a report, we will consider that report, and with any area of government, if things can be improved, if areas can be changed, if areas of government can be enhanced, we will always look at that. We do that all the time.
ICAC's Chief Commissioner has described the funding model as unlawful. I mean, some of the delays and issues that they've had, they've linked directly back to the funding model. Will you make a commitment to address this funding issue, or are you going to wait until a report comes, who knows when, on Glasbury-Gickling?
Well, they're two separate issues. They're completely two separate issues.
So
there has been discussion and reports in relation to funding for independent agencies of government. The government is committed to examining that. The former Premier was looking at that aspect herself, and in due course I will as well. And the government will make a decision.
When will you do that? It's been on the cards for ages. When will you make a decision on
Well, I've been in the role for a few weeks. There is a lot on the agenda, and in due course, I will look at those aspects. Yeah.
But they could go fast if they had the money that they want.
Look, as somebody who was a former treasurer, there are always areas of. There is not one area of government that says, "Can I have less funding when it comes to budget time?" Every area of government, whether it's the health minister, the jobs minister, the education minister, the police minister, thank you, Chris. Every area of government, always would like more resourcing. That is part and parcel of public life. It is the job of the Treasurer of the day and the Executive to consider all those competing interests and make a decision. There are always very valid arguments in relation to the allocation of public funding. We will look at that. I understand the issues that have been raised in relation to the independent agencies and the ICAC and the Electoral Commission, and I will be looking at that in due course.
Do you think Glasbury-Gickling should have resigned last year when these allegations were first aired and avoided what some of your colleagues have described as burning bridges on the way out?
I wouldn't describe it in that way at all. I think the Premier was a superb Premier for this state. Gladys Berejiklian served the people of New South Wales tirelessly. She was the most hard-working Premier that I have ever seen. Her resilience as Premier I have never witnessed in anyone before. The people of New South Wales are better off for the leadership and the dedication that Gladys Berejiklian had for the people of our state. And I can say, as somebody who worked very closely with her as Treasurer for 5 years, the people of New South Wales are incredibly blessed to have had her serve close to 5 years as Premier of New South Wales.
Do you have WeChat, or would you have any concerns if your ministerial team had WeChat on their work phone?
No, I don't have WeChat. Don't even know what WeChat is. Okay, well, I'm sure there are many ministers, many members in this room that have WhatsApp and the like, but ultimately, not well. I don't know what WeChat is. But the point is, if there are, this goes back to Chris's question, if there are changes that need to be made to the Code of Conduct because of technological advances from points in time, then clearly the government would look at it. But I'd also say that's the role of agencies to provide that advice to government. But,
yeah. The extension of the tax on gyms and dance classes, they're feeling a bit hard done by. You can have massive events, nightclubs, hundreds dancing at a wedding, but 20 in a controlled setting where they can space out. Why?
At a gym?
Yeah, in a dance class.
Look, these are all. We always try to take a balanced approach here, and we sit down with the health team and we look at where are the higher risk settings in place and how can we mitigate against that. We then balance that up with the economics advice. So, I've lived this as Treasurer for the last 18 months. Whenever we make changes, there will always be, well, hold on, how does that marry up with that? I accept that concern. But I think the consistency that we found today is pretty good. I think the fact we've been able to bring forward all these changes is a testament to the hard work and efforts of everyone across our state. We always strive to have as much consistency as possible. There are settings that health will say are higher risk. We examine it, we prosecute it, and I believe where we've landed today is, as the Health Minister said, this is a great day for the people of our state. We did not believe we would be here. We did not believe we'd be in a position we could bring by the 8th of November a number of these restrictions off. It's great for freedom, it's great for opportunity and prosperity for businesses and workers across our state.
Premier, the estimates, we've got
Yeah.
Estimates this morning confirmed that the Inner West Light Rail network is going to be out of action for at least a month. Is that good enough? A month? Because of cracks in the trains.
Well, I know that in fact, I was with the Transport Minister last Friday when this issue.
You know a lot about it in estimates, though.
I'm sure he did, and I'm sure Minister Stokes gave a sterling defence of the government in estimates today. But look, there are always going to be challenges in respect of the public transport network from time to time. Where improvements can be made, they will. But you know, when you're building $108 billion of infrastructure over 4 years, when you've got a track record where you've substantially turned around the public transport system in this case on the back of substantive investment, then from time to time there will be issues. What's most important is when those issues arise, they are dealt with quickly, and I have complete confidence that the Minister and the team at Transport for New South Wales will resolve that matter as quickly as possible.
A month, to be fair, a month isn't really quick.
Well, that would depend. Clinton, that would clearly depend on the substantive nature of the issues in relation to the network and the safety concerns. So what we won't do is rush back services in circumstances where it impedes public safety. We'll work through those issues, and if there are things or changes that can be made moving forward, the government will. Thanks.